Welcome to today's video about 7 warning stroke signs in women. Detect it quickly. Did you know that the stroke signs can be subtle and are often ignored, especially in women? What if I told you that recognizing them in time could save lives? In this video, I will reveal the 7 warning stroke signs in women and show how early detection can make all the difference. Stay with us until the end to discover prevention and treatment strategies that can save lives. According to the American Heart Association, women have a higher stroke death rate than men in the United States. Be sure to watch until the end because we will share information about risk factors and prevention as well as talking in detail about each of the 7 stroke signs in women. Your attention to these details could be the key to saving your own life or that of someone you love. Cerebral vascular accident (CVA), popularly known as stroke, is a very serious medical condition that occurs when blood flow to an area of the brain is interrupted or reduced, compromising the flow of oxygen and nutrients essential for the full functioning of the cerebral tissue. Within minutes, brain cells begin to collapse and die. Although strokes can affect both men and women, there are some differences in risk factors, symptoms, and even survival rates between men and women. Women have unique risk factors such as birth control pill use, pregnancy, and menopause. Additionally, stroke symptoms in women may be more subtle or different from those traditionally recognized. Let's now find out what the 7 warning stroke signs in women are. It is important that you know that all of them are critical signs of a possible stroke that require immediate medical attention. Sign number 1. Sudden weakness in the face, arm, or leg. Women may experience a sudden loss of strength or sensation, making it difficult to lift an arm or smile. This symptom usually affects only one side of the body and can range from a mild tingling sensation to complete paralysis. One way to notice this sign is through the smile test or raising your arms. Ask the person to smile or raise both arms over their head. If one side of the face appears droopy or one of the arms begins to drop involuntarily, this could indicate a stroke. If left untreated, the weakness can progress to permanent paralysis, depending on the area of the brain affected. This can result in an inability to move certain parts of the body, speech difficulties, or even changes in perception and personality. Recovery can be limited, and in many cases, requires lengthy rehabilitation focused on restoring as much mobility and function as possible. The ability to perform simple daily tasks such as dressing, eating, and walking may be lost. Therefore, it is very important to understand that time is of the essence when treating stroke. The faster the intervention, the greater the chances of recovery and minimization of long-term damage. 2. Sudden mental confusion or difficulty speaking or understanding. Women may have sudden difficulty speaking clearly, stammering, or understanding what others are saying. This is one of the alarming signs of stroke that may be more pronounced in women than in men. This sign reflects the impact of stroke on the areas of the brain responsible for language and communication. During a stroke, when blood flow to an area of the brain that controls language is interrupted, the ability to process or express language can be immediately affected. This can manifest as aphasia, which is difficulty speaking or understanding words. The person may speak in disjointed sentences, use the wrong words, or simply be unable to say anything. Diagnosing this sign involves observing the person's ability to repeat simple sentences, name objects, or follow basic commands. A clear example of this sign is when a person suddenly starts stuttering, can't find the right words to express themselves, or seems confused with simple commands. Another example is when someone is unable to understand what is said to them, even in simple conversations, or responds incoherently to direct questions. 3. Vision problems in one or both eyes. Blurred vision, double vision, or sudden loss of vision, especially if it occurs without explanation, can be a warning sign of a stroke. This symptom can be very serious and manifest itself in different ways. Blurred vision, double vision, or sudden loss of vision can occur in one or both eyes. This sign is particularly insidious as it is often overlooked or attributed to other less serious causes. Vision problems during a stroke occur when blood flow is interrupted to the parts of the brain responsible for our ability to see. This can result in temporary or permanent damage to brain cells that process visual signals. You can best recognize this sign by assessing visual acuity. the ability to follow objects with your eyes, and the pupil's response to light. A practical example of this sign is when someone suddenly cannot read texts that they previously read easily, or when the person starts bumping into objects due to a loss of peripheral vision. Another example might be someone who suddenly sees spots or experiences double vision, making it difficult to focus on specific objects. 4. Difficulty walking, dizziness, loss of balance or coordination. Women may experience sudden disorientation, lack of coordination, or severe dizziness without a familiar or apparent cause. This can be a strong warning that you are having a stroke. These symptoms may indicate that the stroke is affecting the parts of the brain responsible for movement and spatial perception. When the blood supply to areas of the brain that control balance and coordination is disrupted, it can result in sudden disorientation and difficulty walking. A practical example of this sign is when a person suddenly feels unable to walk in a straight line, trips frequently, or is unable to stand without support. Another sign may be the sensation of spinning or that the environment around you is spinning vertigo, which can lead to a serious loss of balance. 5. Severe headache with no apparent cause. A sudden, intense, unexplained headache may be a sign of a type of stroke called a cerebral hemorrhage, when bleeding occurs inside the brain. This type of headache can be significantly different from any headache the person has experienced before. The headache associated with a stroke occurs when bleeding or blockage in the brain increases pressure inside the skull, causing sudden severe pain. In cases of hemorrhagic stroke, bleeding can irritate brain tissue or the linings of the brain, resulting in a severe headache. A practical example of this sign would be a person who suddenly develops a headache so severe that it is described as the worst headache of their life, possibly accompanied by nausea, vomiting, or an extreme sensitivity to light and sound. Unlike common headaches, this headache comes on without warning and reaches its peak intensity very quickly. 6. Unexplained fatigue. Although less well known, extreme tiredness or a sudden feeling of exhaustion for no reason may be a specific symptom of stroke in women. This symptom is usually accompanied by another one on our list. We are talking about a type of fatigue that is not relieved by rest or sleep and can seem disproportionate to any physical or mental activity performed. This sign appears when the area of the brain responsible for energy and our alert system is being affected by the stroke. Diagnosing this symptom as part of a stroke can be challenging, as fatigue is subjective and can be attributed to many other conditions. 7. Sudden changes in behavior or confusion. Unexplained changes in personality or severe confusion can also indicate a stroke, especially in women, as a stroke can directly attack areas of the brain that are responsible for cognition, perception, and emotional regulation. The affected person may begin to act disoriented, not recognizing people close to them or even familiar places, such as their own home or workplace. Another common situation that this sign generates is an abrupt variation in mood, such as suddenly going from calm to aggressive. In addition to the inability to perform simple tasks that require some degree of decision-making, such as, for example, choosing an outfit to wear or preparing a small meal. Recognizing these signs can make the difference between life and death. But it is also very important to know what the risk factors for stroke are in women. Some of them are the most common, such as hypertension and diabetes, and are valid for men and women. However, women have some unique factors, such as a history of preeclampsia or eclampsia during pregnancy, use of hormonal contraceptives, postmenopausal hormone replacement therapy, and migraine. If you face or have faced any of these conditions, know that you have a higher risk of being affected by a stroke. But the good news, and this applies to everyone, is that we have the ability to prevent serious health problems such as stroke by living healthier. And obviously, you already know, but it never hurts to repeat, that when we talk about health, it is essentially to talk about prevention. How to prevent a stroke. Stroke prevention involves managing some risk factors that are extremely controllable. Healthy diet and regular exercise, control blood pressure and diabetes, reduce alcohol consumption, and eliminate smoking from your life. Another very common question regarding stroke is about treatment. Some people think that it is necessary to undergo some type of invasive surgery or that anyone who suffers a stroke will always be left with aftereffects. This is a mistake. Immediate treatment for stroke may include medications to dissolve clots, prevention of additional clots, and in only some cases, there is a need for surgery to reduce damage to the brain. Regarding sequelae, one of the most determining factors that can count as positive points for the patient's full recovery is exactly the speed of diagnosis and the time taken to receive medical care. This is precisely why our video had a great focus on recognition of the 7 most common signs of stroke in women. By highlighting these signs, we aim to help viewers identify a potential stroke quickly and seek prompt medical attention, which can significantly improve the chances of a full recovery. Did you find this content useful? Do you know someone who has already experienced a stroke? If so, leave your comment below and share this video with all your friends and family. Before you leave, we invite you to watch 2 more recommended videos popping up on your screen right now that I'm sure you will enjoy. Thank you for watching. Stay healthy. Bye.